Hello everybody, I'm Dr. Randy Cook for MD Coaches, and we're celebrating Nurses Week this week, and in honor of that I wanted to share some of the stories and insight as to how I began to understand and appreciate just how much nurses do. Way back before I started to medical school, in fact for an entire year before I started to medical school, I went to work as an orderly in a very busy surgical intensive care unit in a very busy university hospital. And I was working alongside some really amazing nurses. And when they learned and understood that I was headed to medical school, they all went out of their way to teach me everything that they had to offer, and it was a lot. I learned how to diagnose about a half dozen different cardiac arrhythmias by looking at a tiny little 4-inch oscilloscope screen where the tracing disappeared almost as soon as it was there, and there was no button to push to get an immediate rhythm strip back in those days. I learned how to titrate an epinephrine drip to keep the blood pressure exactly right by watching the drops fall out of the bottle and into the tubing and time it with the second hand on my watch. Those things were very important, but perhaps even more important than that, I learned how to clean up and strip and remake a hospital bed with the patient still in it. And I also learned that I would probably have to do that again in about a half an hour. And if you're a nurse, you understand exactly what that means. But I think undoubtedly the most important thing that I learned was what the nurse's life was like during the 95% of their day and the 99% of their night when there was no doctor in sight. I understood at that point that for the rest of my professional life, those nurses would be my eyes and my ears and my hands while I was away. So thank you, nurses, for everything that you do, and particularly during this time of incredible pressure because of a worldwide pandemic of COVID-19. And remember, we see you, we believe in you, and we couldn't do without you. Thanks for listening.